Good day, everyone. I am Christine, the moderator for this webinar. I welcome everyone to today's webinar that is remote telepractice and mental health care, HIPAA do's and don'ts with an emphasis on state licensure law. I would like to introduce our presenter for today, Mark R. Brengelman. Mark holds bachelor's and master's degrees in philosophy from Emory University and a Juris Doctorate from the University of Kentucky. I would now like to hand over the floor to the speaker. Over to you, Mark.
Thank you very much, Christine. I hope everyone can hear and see me well today. So good afternoon to everyone on Central and Eastern. Good morning to everyone on Mountain and Pacific. We'll talk about the basics of HIPAA privacy as applied to telepractice of mental health. We also have guidance from national organizations like the American Psychological Association that is guidelines for their professionals in mental health. This is a relatively new disclaimer. It's one that I think states the obvious. We're a little bit past the COVID pandemic. There were 10 years worth of change in remote medicine that occurred in a matter of weeks due to the COVID pandemic. This webinar will govern privacy standards as applied to telepractice when work from home becomes practice of mental health from home for mental treatment. We have to identify HIPAA privacy basics in relation to mental health. So if you're a practitioner in mental health and you want to do telehealth with the patient, here are some tips for a pre-session evaluation checklist. So the technology standards include, is the electronic platform HIPAA compliant? So setup standards checklists include, do both parties have a quiet, private space to attend the session? Even going to the car in the garage would be acceptable if you could do that. So a pre-session checklist, some of this stuff is things you should be doing anyway as a therapist to maintain confidentiality and HIPAA compliance. So at the beginning of the virtual session, confirm that nobody will record the session without permission. So as far as I know, approved HIPAA compliant platforms include Skype, which I understand is defunct as of this year. There's Zoom for healthcare, Amazon Chime, GoToMeeting, not approved, Facebook Live, Instagram, Twitch, TikTok. Some HIPAA compliant fail safes would be when they log on, when you start a video session, that there's a two-factor identification. So encryption, make sure that your HIPAA compliant encryption exists with the software that's provided. Obviously, password protection is paramount, and I've already mentioned antivirus and anti-malware protection. So there's competency. This is actually from the American Psychological Association. It's not the law, but the national guidance talks about first competency. So at home, it can be difficult to maintain the confidentiality of the space, the boundaries. It's still important to maintain professionalism, including dressing for work, sticking with a regular schedule, start time, staying in the role. Now let's move to informed consent and telehealth to document. So let's take a deep dive. We're about 2/3 of the way through our material. You have to inform and writing about the limitations of using the technology. These mental health practitioners have to limit the practice. You have to ensure about confidential communications, how they are obtained and stored electronically and cannot be accessed by unauthorized persons. If you use telehealth under this example law, you can maintain HIPAA confidentiality, but you can't engage in false, misleading, or deceptive advertising. You start with definitions. Asynchronous is defined, electronic communication, encryption. So in this example, every LMFT therapist who practices telehealth shall be licensed by the board and comply with all laws applicable to the marriage and family therapy practice. There's a continued competency requirement that requires not only initial training, but ongoing training, and those credits can be applied to the regular continuing education requirements that everybody else has. Initial assessment, these are requirements for mental health. Before providing telehealth services, do these things. These are all the things that tell you up until this slide how to do what you want to do and how to do it well and safely. Disclosure of specific information. You have to maintain time zone differences, culture and language differences, contacts, coordination of care, and conditions of telehealth and emergency procedures. So compliance with privacy laws, documentation, you still have to document, you still have to comply with the other requirements. So here were some samples of state licensure laws and the telepractice of mental health. The basic tips and techniques to defend yourself is to know the current HIPAA laws and encryption laws and use a HIPAA compliant platform. Everyone do well, do good things, stay safe out there. This has been a worthwhile use of our time. And we hope we've been very concise and very clear about do's and don'ts. Go back and look at the material, make your own checklists, and I will wrap it up there.
Thank you, Mark. That concludes the session for today. Thank you everyone for participating. You may all disconnect now and have a great weekend.